the door. You'll come in, you'll introduce yourself. You're saying, I'm Ms. Schneider, I'm a clinical instructor, and I'm going to be taking care of you today doing a physical assessment. And then you ask them what's their name. So what's your name?
Marina Simmons.
And you double check with their name band and say, sometimes they'll have two identifiers verifying who they are. And then what you want to do is explain the procedures that we're going to be doing a complete head-to-toe assessment. If there's any, if you feel uncomfortable in any way or you have any questions, please let me know about that. Then you would want to ensure privacy, that kind of thing. You would also, before the exam begins, you could also have them make sure that they have comfortable clothing on. They get into a nursing gown or that kind of thing, and they would empty their bladder beforehand. So if I was actually doing this as a real practitioner, there'd be a couple things I'd do right away to, I'd have her go over and get her weight on a scale and probably do the Snellen chart, those kind of things. But I'll try to follow along your slip so that you can see how the procedure is done. So sometimes I'll group things together for ease of patient and for eliminating the up and down aspect, limiting their changes of position. So the very first assessment, you begin right from the very get-go, is their general appearance. So I'm actually going to take a good look at Ms. Tamez, and I'm looking to see her personal hygiene. Is she well-groomed? Is she wearing clothing that's appropriate for the weather conditions outside? Those kind of things. So her personal appearance, her personal hygiene. Does she look like she's clean? That kind of thing. And then I'm going to go into emotional status. Is she calm? Is she cooperative? Those kind of things. Is she nervous, agitated? There's other things that you would be noticing about that person. Then this level of consciousness. So I'm going to ask her 4 different things. I'm going to ask her, I've already asked her what her name is. Can you identify what time it is?
It's about almost 9.
Okay. Do you know what day of the week it is?
Wednesday.
Good. And do you know if it's what season of the year it is? Fall. Good. You only really need 1 for identifying time. And do you know where you are?
At Houston Baptist.
Okay. And do you know why you're here? Okay, great. So person, place, time, and situation. So she's level of consciousness is 4, and you're going into cognitive functioning. So you're checking mental status again. So I'm going to ask her a series of questions. First one is usually an analogy of some sort. So I'm going to use, find the relationship between these words and fill in what a word would be to match this. So if a dog has a paw, a horse has a...
Like a hub? Or,
yeah.
Yeah.
Okay, that's good. And I'm going to give you 3 words to remember, and I will ask you those 3 words later in the assessment. So it's going to be tree, balloon, bed. Can you repeat those back?
Tree, balloon, bed.
Okay. And can you tell me where you went to high school?
Yes, prep.
Okay, great. And then I'm going to test recent remote memory. Also, I'm going to test cognitive abilities with having to do with critical thinking, having to do if she'd know how to abstract think. So if there was a fire and there was a small child there, what would you do? What would you do?
Remove the child from the situation.
Okay, great. And then the last thing is mathematical calculations. So if tell me what the answer to this response would be. 5 times 5 minus 2.
5 minus 2.
Great. Okay, perfect. So we've done a lot of the mental status from there, and I want to go back to a couple more things. With her, so that's the cognitive abilities, and I'm watching her speech. If it's slurred, that kind of thing, to see if there's any, and if it's coherent, if it's understandable. So by answering those questions, I can see her speech pattern. And then I'm looking in nutrition. This is still under general appearance, whether she's looking like she's healthy, she's not obese or emaciated, and then I'm looking for gross deformities, whether she was missing some type of arm or limb or things like this, using any kind of assistive devices. The next thing then I would do is vital signs. So I won't repeat those right here, but I would do temperature from using the temperature probe. I take her pulse, usually with a radial pulse, at the same time for 30 seconds. Then I would be assessing her respiratory rate for the second 30 seconds. If I had a hard time assessing respiratory rate, I could also take, without letting her really know, I could also listen with my stethoscope close to where her trachea is, listening for the exchange of air there. Then you can do the blood pressure. We do the blood pressure. Then there's pulse oximetry. So you would take your pulse oximetry, you clean it off with alcohol wipe, you check capillary refill on your fingers, and you do oxygen saturation reading. You'd also assess for pain. So are you in any pain today?
No.
Okay. If she did identify she was in pain, I would do some further assessment doing a pain scale from 1 to 10 and have her describe what the pain is. If at that point she was in severe pain, I may stop the assessment. Maybe the data I would collect might be altered because of that, and address that pain issue. The last two things would be having her get her weight, height, and weight. So normally you go over and you get the height and weight. We can just ask, in your head to toe, just ask them what their height and weight is, and we'll gather that. You'll be doing a BMI with that. So that's all with general appearance and with vital signs. The next step is going to look at skin assessment. So skin assessment is actually at her whole total body. So I'm going to start with her face and neck, and I'm looking at the general coloration of her face. I'm seeing if it's appropriate for ethnicity, acne, any kind of moles, lesions, things like this. Also around her neck area also. Then I would expose part of her chest area, looking here, and I could go around the back side if she has an open gown, and I'd look on the back too. For any kind of especially sun-exposed areas, mold, tattoos, lesions, scars, anything visible on the skin. I'm inspecting, and I can also palpate. I may want to palpate for skin temperature, texture, things like this. Be mindful if she's got any kind of rashes that I'd want to be wearing maybe gloves, that kind of thing. Other than that, I'd be looking at that general texture, contour, color of her skin. Then you're going to look at the upper and lower extremities, also at the skin. So I'm going to look first at her upper extremities. I'm also going to look for any kind of lesions, moles. Now, if they've identified a mole, you're going to use the ABCDE assessment to identify if it's something that you would want to do further follow-up or document and have them do further follow-up. She does have a mole on this side of her, so you'd be documenting that with a head to toe, no acne, that kind of thing, clear skin. Now, when I'm looking at her upper extremities, I'm going to test for skin turgor. So I'm going to check for dehydration, and I'm going to also assess for capillary refill. I'm going to checking for adhesion to the nail bed, and then I'm going to have you check for clubbing. So if you can put your fingers like this, you're looking for the angle. It should be less than 180 degrees, which it is. Thank you. So I've done the upper extremities. You can palpate too for any kind of nodules. Now you look at the lower extremities. Start with the thighs, down to the calves, the same kind of assessment that you would be doing, looking for scars, lesions, discolorations, rashes. And then you look at her lower extremities and her toes. You're going to be checking capillary refill for her toes also, and adhesion to the nail bed with the lower extremities. They might have cold feet, things like this. You're checking temperature also, and then I'm going to check the lower extremities for any kind of edema. So if I have identified edema, then I would rate that on a scale from 0 to 4, depending on how long the indentation is there and how deep that is. So that was with the skin assessment. Now I'm going to actually do the head to toe part of this. So I'm going to start with looking at her head. So she's at one other thing I want to mention is she's at a good working height. So I'm not bending over a lot, making sure she's in a safe position too. So I'm looking at her general head. I'm looking at the size and symmetry of this, that kind of thing. And then I'm always inspect first, and then I'm going to palpate. I'm actually palpating her head for any kind of nodules, masses. I'm looking at her to see if she's got any tenderness, this kind of thing. She looks really good, doesn't have any of those, looks like any suture lines, any tenderness when I'm doing this. And then I'm going to also look at her hair. I'm looking at the luster, inspection of the hair. I'm looking at the luster. I'm looking to see if there looks like there's any kind of light, things like this. If it's the shine, the texture, I'm going to feel that also. And it feels like it's in good shape. Shiny, smooth, that kind of thing. Looks like a normal distribution pattern also, that she doesn't have patchy areas, things like this. So that's head. Then I'm going to go next to the eyes. I'm going to look at her eyes, and I'm looking first at symmetry of her eyes, the positioning of on her face. And they look symmetrical. Also, I'm going to be looking a variety of different things. I'm going to look actually on the side profile, if you can look straight ahead. I'm looking at the cornea. I can see the little clear, extended from the outer part of the eye. I'm looking at all areas of her eyes. I'm looking at see if there's any drainage, redness, swelling. I'm looking at eyelashes, eyebrows. I'm looking for nodules, things like this. And then I'm going to, when I'm done with inspection, I'm going to do palpation. I'm going to palpate for the lacrimal gland and the lacrimal apparatus. So that lacrimal gland is up on the upper part of her eyelid, and the lacrimal apparatus is down towards the inner aspect of her nose. I'm also going to look at the conjunctiva. So I'm going to have, can you look up in the air? Have a look. It looks like it's pink. And that's, look at like that. Also, I'm looking at, I think we're starting with that. I'm looking at the corneal. Okay, so I've palpated and I've inspected. I'm going to go and do my special examinations, and the first one is cranial nerve number 2, having to do with vision. So you can assess them if they're fewer consequences. So what you're going to do is take your pocket Snellen chart. You stand 6 feet away, and you identify and have them cover one eye. I'm going to stand up this way so I don't look too far away. And can you read this line here?
LTFH.
I know that's wrong.
I can read the line before.
Okay.
GSBHJ. Oh, or something like
C. Okay. So you'd have them identify the last one. You do one eye, both eyes, one eye, the other.
And then I can read the last one, which is
okay.
LTF. Oh, yeah, FFH? PVH.
Oh, okay. So you would take one time at a time. They can miss 2, and you could, other than that, you go on to the next one and have them identify one eye, the second eye, and both eyes with corrections, that kind of thing. So that's the Snellen. That's looking at far vision. And we'll do the Rosenbaum card. This is held 14 inches away. On some of the videos, it measures it this way, but you think that it's a ruler, and it's just about 2 inches more than a ruler. It's going to be like this. They're also going to read the small little lines. If you can cover one eye, let's see if you can identify. Can you read this line here?
4, 2, 6, 7, 5, 9, 1, 9. I don't know. Okay, 9, 3, 7, 8, 2, 6.
Okay, and on your other eye, cover it and read it backwards.
I can read the bottom line
okay.
with this eye.
Okay.
9. No, okay. 6, 2, 8, 7, 3, 9. I can't make up these 2 numbers.
Okay. And then you would identify what their vision is on the side, because it tells you whether it's 20/25 or 20/25, and you'd identify which eye it is. So this is the Rosenbaum card. This is for near vision. Also, another test, if you don't have one of these cards, you can take a piece of newspaper. They're usually in a certain font, and see if they'll be able to read that. Now we're going to test peripheral vision. So I'm going to get very close to you. You tell me when you can see my fingers moving. Okay, so you're going to look straight ahead at me.
No.
Okay. So that is cranial nerve number 2, the optic nerve. The next cranial nerves are 3, 4, and 6. They do a variety of looking at the movement of the eye. So I'm going to be using pen light for some of this. I'm going to have you look at the pen light. There's several of these exams that I'm going to have you do. First one is looking at all the 6 cardinal directions. So I'm going to have you follow this along. Looking for smoothness, evenness of the eyes moving. See if there's any irregularities, convergence. Okay. Then I'm going to actually shine a light in your eyes. I'm going to check corneal light reflex, which is seeing the white part of their eye, seeing if this is the symmetry of that. This is part of the assessment part, and that looks really good. Now I'm going to do the constriction, pupil constriction with the light. So it's called direct. Okay. And normally I might even shut the light down a little bit, test each eye. You're looking at size. And then you can check what they call concentric. So see if the opposite eye is actually constricting to at the same time that the direct eye is. So sometimes you'll see this, where you'll do this and they might move it over a little, but you might be altering that because you're already shining a light in the second eye. So be mindful of that. That's called concentric. Now, Perla, I'm looking for pupils. Also, when I'm looking at and assessing, I'm looking at where the lid location is. It should be covering part of the iris, but not part of the pupil. So now I'm looking at Perla, pupils equal round reactive to light and accommodation. We know that I've already assessed their size. They're equal, they're round, they react to light, but now I want to add the accommodation part to it. So Marina, I'm going to have you look at this tip of this pen, and then I'm going to have you look over there at the line. Okay? And what I'm doing is observing and looking. So look at her at the tip of the pen. I'll look at the pen. Good. So what she should do, and her eyes are very good with this, is they should constrict when they look at something closer. So that's called accommodation. That's all the eye examinations that we have, and we're going to go on to ears. So we're going to look at the location of where your ears are. That's when you look at, see if the inner canthus of the eye, the inner outer canthus, lines up with the pin of the ear, so you can see if if that's lining up symmetrically on both sides. You're also looking at coloration of the ears. Is there any kind of a variety of different things, whether they've got piercings, things like this, the color, that kind of thing. And then what you're going to do is you're going to palpate. So you're going to palpate not only the auricles or any tenderness, masses, but you're going to also palpate around the ear, the surrounding area, all the way around. You're going to palpate around where the mastoid is too. You're going to palpate all around for any kind of nodules or tenderness, masses, things like that. Now there's a variety of ear tests that we're going to be doing. The Ryan and the Weber we don't do percussion or auscultation with the ear. You can also, if you'd like to, with inspection, you could look in the ear canal a little bit to see if they've got any kind of ear wax or anything built up. You can see it from the outside of the auricle. So you could lift it up and back and just kind of look and see what the hair distribution is in the ear and what color it is. You cannot visualize the tympanic membrane from here. You need the otoscope to be able to do that. Still part of inspection. So there's a variety of tests we're going to do. I'm going to start with the Weber test. This is checking for, and you're going to tell me what the sensation, if it's bilaterally, if you feel it more in one ear, the other ear, or both ears. So you'd activate your tuning fork, you place it in the middle of the forehead, and you feel vibrate. Good. Good. And that's what you want. It would be abnormal if she had it in one side or the other. Then you're going to do the Ryan test. Make sure you have your watch handy because you're going to be timing bone conduction versus air conduction. You're going to place this, I'm going to place this on your mastoid. And when you stop feeling the vibrations, let me know. I'm going to place it in front of your ear. When you stop hearing the sound, let me know. Okay? So you activate the tuning fork, place it on the mastoid, you start timing. Do you feel it? No. And that's good. Your bone conduction was, well, your air conduction was twice as long as the bone. The bone was really quick. It was about 4 seconds, and the air conduction was about 12. So that was fine. So that's what we want. That's a normal response. Now we're checking cranial nerve number 8, which is acoustic, vestibulocochlear, or auditory, variety of different names it goes by, and it's a watch or whisper test. So I'll show you actually both. Sometimes I'll say, can you hear this? And then sometimes I'll whisper a word in one ear and the other ear. So you'll occlude one ear and you whisper something. And you check both ears. Okay, secret. Yeah, secret. Okay, that's fine. So you're checking cranial nerve number 8, and that's intact. So that ends our ear exam. We're going to go on to the nose. So we're looking at the position of the nose on the face. You're looking at the coloration. You're doing the inspection phase of that. You're seeing the coloration, if there's any acne, any nodules, things like this, along with the nose. And actually, I'm going to put my gloves on for this because I'm going to go right from here to the mouth. And I'm going to check inside. Part of the inspection is inside the nasal cavity. You can use your otoscope, but you can also use your pen light. So, Marina, I'm going to have you lift your head up, and I'm going to actually look inside at the turbinates, hair distribution pattern. I'm looking for polyps, and I'm actually looking to see if there's a deviation of your septum. And the turbinate shape is pink. So that looks okay. That looks all right. Have you ever broken your nose? No. No, you look fine. Sometimes you can see a deviation, that kind of thing. Then that's inspection, and then the second is palpation. So you're going to palpate the nose, actually palpate the frontal sinuses, which are up above here, close to the ethmoid, and then you're going to palpate the maxillary sinuses down in the kind of lower cheek area. Palpate this area too. If they complain of pain in any way, especially the maxillary sinuses, you do translumination, where you shine this and look on the inside of her mouth, and you see if there's any fluid filled, if it shines through. That's called translumination. This is cranial. Then I'm going to check cranial nerve number 1, which is olfactory smell. So I'm going to check patency first, just make sure she has able to smell. So I'm going to actually occlude one there as you have a breathe out. Good. Woo, strong. Good. And then I'm going to have you close your eyes and see if you can identify a smell for me. Okay. Good. And we'll do the other ear. This is cranial nerve number 1, olfactory. Yeah, for coffee. I actually think that's coffee.
Oh, really?
Yeah.
Oh.
I'll have to check and see, but you could smell something.
Yeah.
Okay. Okay. That completes the nasal and nose assessment. We're going to go on to the mouth. Actually, we do mouth and we combine mouth and face a little bit. So this is quite extensive because we do a lot of preliminaries with this one. So the very first part is I'm looking, inspecting is always the first part of that, where you're looking at her lips. You're looking at the symmetry of her lips. You're looking at the coloration of her lips. You're looking at the dryness. Is there cracking? Are there lesions? Those kind of things. Then you're going to look inside their mouth. So I'm going to have you open your mouth. I'm going to have you open your mouth, and I'm going to look actually just at the mucosa first. I'm going to look at her teeth structure, and if I need an additional light source, I'll look all around this, her teeth look pearly white, her gingiva, her gums look all good, buccal mucosa looks fine. I'm going to look at the underside of your tongue, so can you lift your tongue up at the sublingual? I'm looking at the frenulum. That looks all intact there. Okay, lower your tongue down. And I'm also going to look at the top roof of her mouth, the palate, the hard and soft palate. And then I'm going to look at the uvula. So I'm going to have you say, oh, nice. Okay, normally at this point in time, you'd identify, you'd let the patient, you'd tell them it's going to do the gag reflex, and that would be checking cranial nerve number 9 or 10. You could have them phonation, so we'll try, can you do A-E-I-O-U? And I also check the rise and fall of the uvula, so that's the glossopharyngeal vagal nerve, swallowing, gag reflex, A-E-I-O-U, and the rise and fall of the uvula. Also, taste is part of that. We don't test taste here. When you're done with all of this, then you throw this away. We're going to continue with some of the other cranial nerve specialty examinations with the face and mouth. I'm going to start with hypoglossal. That's her tongue. So could you stick out your tongue again? So I'm looking to see if there's a tremor to the tongue, if there's symmetry, if she sticks it out, if there's any kind of deviation. I'm looking at the coloration, coating on the tongue. And then I'm going to have you do your tongue. Can you raise your tongue up? Can you point your tongue down and side to side? Good. And then I'm going to have you do tongue strength. So I'm going to have put my hand on either side. And good. So that's cranial nerve number 12. That's called the hypoglossal. There's several other cranial nerves having to do with the face. We'll start with the, so we've done 9, 10, 12. Let's do trigeminal nerve. Trigeminal nerve is sensation and motor, so it's two different tests. I'm going to have you feel. This is going to be soft, and this is going to be sharp. You're going to identify this sharp, the sensation. Actually, I'm going to do this to as I'm going to do your face and your entire body at the same time. So I'm going to combine this from the neuro at the same time. So close your eyes, and you want to at least do 3 sections of the face. So. you're through. Normally they wouldn't have all this clothing on. Okay. So I don't need this anymore, so I'm going to throw this away. Also, that's part of the trigeminal, which is cranial nerve number 5, sensation, but it also is a motor, so we're going to do the clenching of her teeth. So I'm going to have you clench your teeth, and I can palpate it here. Good. And clench again. You can feel it palpate in both locations. Now I'm going to have you open and close your jaw. Oh gosh. Okay, that's checking TMJ. Do that one more time again. She's positive she has a little bit of that. Yeah. You're looking for crepitus, any kind of it's not smooth, even motion with that kind of thing. So that's TMJ. I'm also going to check cranial nerve number 7, which is the facial nerve. So I'm going to have you do different facial expressions. So can you smile with and without teeth? And with teeth. Okay, can you frown? Can you puff out your cheeks? Can you do fish lips? Okay. And can you raise your eyebrows? And can you skull? And then you can even try strength. Can you raise your eyebrows again? Good. You're checking for symmetry. When you're doing the facial nerve, it's all about movement and motion, and you're checking for symmetry from side to side. And then I believe that's all of your face. Now I'm going to go down into your neck area. First thing is I'm going to assess your neck for inspection. I'm going to see if her head is being held upright and see if there's symmetry. I'm going to locate see if the thorax is midline. Identify that. And before I do any kind of other, I'm gonna do some range of motion. So can you do what I do? Can you do a no? I mean a yes. Can you do no? And can you bring your ear side to side? So I'm checking range of motion of her neck. Okay, great. That's a good job. And then I'm going to also check. I'm going to do some palpation with her neck. I'm going to actually, so I don't forget, doing the spinal accessory cranial nerve number 11. So I'm going to have you shrug your shoulders and bring your shoulders up against resistance. I'm checking for symmetry with this. And then I'm going to have you push your hand against mine, turn your head. Good. And I'm also going to have you turn your head towards the other hand. Good. That's spinal accessory number 9. I'm looking for symmetry with that also. Then I'm going to do some looking at her lymph nodes. I'm going to palpate for those. Alrighty, there's several of these. I'm going to do them symmetrically from side to side, making sure there's no, I shouldn't even feel these. They should be palpable. So it's preauricular, it's in front of her ears. Postauricular, behind her ears. Occipital, farther back in her head. Here. Submandibular. Submental. Any pain or anything? Posterior, you're looking for the trapezius. Okay. Posterior cervical chain. Anterior cervical chain. And supraclavicular. So can you turn to, I'm going to do this. There we go. And bring them forward towards me. There. Good. Shouldn't be able to palpate any of those. Next, I'm going to palpate for the thyroid. So I normally have her have a sip of water, that kind of thing, and I'm going to have her stay in that position. I'm going to move as a practitioner. So I've already checked the thorax to see if her midline. I'm going to go to the back side. I'm going to, Ms. Tomaz, I'm going to have you lean your head down just a little bit. It doesn't even have to be that far, so it's not stretched. You're going to palpate for her thyroid, and then I'm going to have you swallow. Okay, good. And I don't know if you can do it again. Can you try swallowing one more time here? Great, thank you. So checking to see if the movement of the thyroid up and down, and check for size and symmetry of that also. And also the swallowing helps with the cranial nerve number 9 and 10, just filling in that hole, that blank. Now also what I'm going to do is I'm going to palpate for her carotid artery. So I'm going to palpate for that. And I'm going to check for buoys. So I'm going to auscultate. And I only do one side at a time. The other thing that you would assess normally at this time would be JVD, but I'm going to defer that because she'd have to be lying down to do that. So I'm going to do that when I do an abdominal assessment with her neck. Okay, I think that's all with the neck. We're going to go on to chest. So, okay, so I'm looking at her chest area. You're going to be looking for effort of her breathing, symmetry from side to side, and you're also looking at her respiratory effort side to side. And you would actually have this area exposed to see if there's any kind of irregularities with this. And then you're going to palpate. So you can palpate the chest area, checking for nodules or pain and tenderness. They might have a pacemaker. They might have a central line. They might have a variety of different things here. So you're palpating the anterior part of her chest. Now I'm going to have her stay in this location, and I'm going to go around the back side. And I'm also going to now look at her posterior side. I'm looking at the level of where her shoulders are. I'm looking at the rate of her breathing, if she's having. I'm looking also to see if she has, actually I could look profile and see if she has any kind of barrel chestedness on the anterior, posterior side of her chest cavity. So I'm looking at this. I'm going to also palpate for temperature, things like this. It looks all okay. And then I'm going to do the inspection. You can palpate also the back to see if they've got any tenderness, any nodules here, that kind of thing. Watching for a variety of different things. So I've done inspection, palpation. Percussion is the next assessment area technique. So you percuss all lung fields, and you do it in a ladder pattern. So you're listening for symmetry. I'm going to actually do some of my other skills before, well, let's auscultate. I'll just auscultate and then I'll do all my specialty skills. So I'm going to auscultate the same thing using the diaphragm part of my stethoscope, and I'm going to have you, can you breathe in and out? And again. Okay. Normally you wouldn't do this over clothing. Listen to the bases. Now I'm going to have you lift off your right arm. And I'm going to auscultate, yeah, or it could be partway. There you go. And I'm going to listen for a right lateral in her middle one lobe. Breathe in and out. Good, excellent. Okay. Now I'm going to do the variety of different tests that we do with the back. First one is thoracic expansion. So I'm going to see if there's symmetry between that. So I'm going to put my hands on the lower part of her kind of thoracic, not the mid-abdominal, but the thoracic area. I'm going to put my fingers together and see if they expand out my thumbs. And I'm going to have you breathe in and breathe out. Should follow a pattern, and my hands should spread evenly. They should be, it should be in kind of asymmetry. I'm also going to check for tactile fremitus. So I'm going to have her say 99.
99. 99. 99.
And you should feel a vibration.
99.
Okay. You do that several times throughout the thoracic cavity. I'm going to check for CVA tenderness, which has nothing to do with thoracic, but has to do with kidney function as part of her percussion technique. So you're going to tell me if you have any discomfort when I do this. I'm going to find her kidneys on each side and do a percussion. Any pain? And that's checking for any kind of pain with that. So I've done percussion, auscultation. I think I'm done with all my specialty exams. I'm going to go around to the front and also auscultate, and I can percuss too. So I can percuss. You start actually up in here. Your lung lobes start in this area, so you can do some percussion. Also in the ladder technique, so you don't want to go, just breathe. You can breathe normal. You want to listen for inspiratory and expiratory for the full round. Okay, now cardiovascular, and we do breast exam too. But I think I'll do cardiovascular first. You can do either one. They're both going to have to be cardiovascular assessment normally is done with the patient lying in supine position. So she'll have to move when we do the breast examination, but you normally wouldn't have them totally exposed with it. So I'm going to do the chest and lungs together. So if I could have you lay down. Oh, are you comfortable? Relax. And I'm going to bring you back. Maybe. Okay, I'm going to check JVD while I have her down here. So I'm going to look from side to side. I'm going to look now. You look towards that curtain. Turn your head. And I'm looking, I can see her jugular vein extended here. I'm going to bring her head of the bed up 30 degrees. Watch it disappear, which would be normal finding. Then I'm going to actually, Okay, you can move your head straight. Can you move up and down? Yeah, I feel like you're sinking down. Perfect. Okay, and instead of reaching over the top of this, now I'm going to do the cardiac assessment. So there's these several things. You're going to inspect, are you comfortable? Okay. You're going to inspect her chest area here for any kind of what they call heaves or lifts, so you can actually see the heart beating kind of outside her chest. It's not the same as the respiratory, where you're looking at respiratory. Right now you're looking at cardiac function. So you're looking, you're inspecting, and then you're going to actually palpate for heaves and lifts and thrills. So you're going to palpate this way, each side. Does it lift? Do you feel a thrill or a rush on your hands? And you can also palpate her mitral area here for any kind of thrills or lifts. So you're palpating this way and this way for cardiac. Then with the inspection part, you could have them, if they were disrobed, you could have them look for the apical impulse. It would be something that you could visually see. It's also, this area here is very, you do everything in this kind of area. You can see it, and then you can palpate it. It's going to be at the 5th intercostal space, and it's going to be mid-clavicular. So it's going to be in this area. You're going to palpate for the point of maximal impulse. So you're going to palpate for that too, right in that area. Yeah. Okay, and then I'm going to auscultate. You don't percuss the chest, but you auscultate, and there's several different areas, and you're listening for any kind of murmurs or abnormalities. If you're palpating here, you could palpate for a full minute doing the apical impulse, that kind of, or apical pulse, that kind of thing. You would palpate for a full minute. You always do apical rates are always a full minute. If you have an abnormality of any of the pulses, then you would also go right to the apical and do a full minute. So you're going to palpate your external identifiers. You have your clavicle here, so you're going to go down to the intercostal, 2nd intercostal space, right at the sternum, and that's going to be your aortic. Right across from that on the left side of the sternum, still on the 2nd intercostal space, is your pulmonic, or you could call it your 1st pulmonic. You're going to palpate down 1. In the 3rd intercostal space is the Erb's point, or the 2nd pulmonic. Palpate down. You've got your, actually it's probably here, 3rd, and with breast tissue it's a little bit harder with women, but it's your 3rd, it's going to be your tricuspid. 1, 2. Aortic, pulmonic, 2nd pulmonic, 4th. It's your 4th is your tricuspid, sorry. That didn't make sense. Aortic, pulmonic, 2nd pulmonic, tricuspid, and then your mitral is over on your 5th intercostal space. So you go down, the only one on the right side of the sternum is your aortic, the rest follow down the left side of your sternum. And you're listening for the lumped up sound, and you're listening to see if you hear any kind of abnormalities, scallops, things like this, any abnormal heartbeat. So that's the cardiac assessment. I think what I'm going to have you do is sit back up at the side of the bed. They will do pulse points. That's the next thing on your list, pulse points. So the pulse points, so we're checking for symmetry of these pulse points, and you're actually checking for the amplitude, and you can measure that from 0 to 4. So always know when you're doing the exam what you're expecting and how you might be measuring or documenting. So you look for the temporal or field pulsing. Carotid, brachial, going to be in this area. Without clothing on. And then, that's fine. And then the radial. We've already found the apical. The femorals will be right in the groin area here. We'll assess that actually when you're doing abdominal. We have popliteal behind the knee area. And actually, can you bend it a little bit? It's pretty diffuse. You go to the dorsal pedis, is the top part of the foot onto the edge of that, and then the posterior tibial is on the interior side, just below where the ankle bone is. So posterior tibial. Checking for symmetry and pulse strength for all of those. Next thing is the breast examination. So I normally have the patient disrobe from the chest, from the shoulder down to the chest, and you're going to be looking at the symmetry. So it's always inspection first. You're going to be looking at the breast areas. Sometimes it's not unusual if they aren't symmetrical in size, but you're looking at coloration, see if you see any dimpling, retractions, things like this. Then you're going to have the patient lift their hands above their head. You're also looking for symmetry, any dimpling, retractions. You're going to have to put your hands on both sides here, and then you can have them forward. So you have at least 3 different positions that you're checking the breast in. Now I'm going to have you lay down. And I'm going to lower this head down. This is a great time to do some patient teaching if they do a self-breast examination at home. When that kind of thing, identify any kind of nodules, things like this. So what position you're going to put your patient in. Marina, I'm going to have you put your face that way. You don't have to turn your whole body. I'm going to have you raise your hand and put this under your, like this. So it exposes the breast tissue, and then I could put an extra toe or pillow under the side of the breast. So it spreads the breast tissue out for better examination. Then you'd have do your breast examination. Okay, you can look so you can see. They don't have to turn. Sometimes it's a privacy issue, modesty, things like this that you're trying to maintain with your client or patient. And you can either do a pattern where you're doing vertical and you're going to palpate. You don't just punch, kind of like this. You want to palpate the circular motions and identify any areas. You want to go entirely, you go into the tail fence area up into here, all the way across the breast tissue. I like doing vertically. Then you can depress where the nipple is and see if there's any kind of discharge also with the nipple, that kind of thing, and you palpate around the area of areola also. If you palpate the entire breast, you could switch over and do the other side. Now I've got her in such great position, I'm going to palpate also for her axillary lymph nodes. So you could take, what you want to do is palpate here, and kind of around where the breast area tissue here, you're going to palpate and see if you feel any nodules or that kind of thing. You shouldn't feel those lymph nodes should not be palpable. Okay, so put your head in. Now there's a couple neural things that I like to add in here because the patient's lying down. So one of them is called the nuchal rigidity. So I'm going to have her bring her head up towards your chest. And that's checking for meningitis, that kind of thing. And I'm also going to check with the circulation, with the circulatory pattern. I'm going to check the Homan sign. I'm going to add in the clonus also at the same time. So with circulation, I think you have the Homan sign. So you just bring back her foot slowly, checking circulation, and if she has any pain, that would be indicative of a DVT, deep vein thrombosis. With clonus, which is found in neurological, you're actually going to bring I kind of relax this foot, just relax, and you bring this back quickly. And if there's a tremor or you count the taps, that would check neural sensitivity, excitability, and it may mean that they are more sensitive. They have maybe, we do it in OB, so they're checking to see if they may be more prone to have seizures, things like this with preeclampsia, a variety of different disease conditions that you're checking. So clonus is neurologic, and Homan's is cardiovascular. And actually, while we're doing this, I'm going to do one more thing because it's musculoskeletal, because we'll do some of the musculoskeletal. Well, we can do it lying down. I'm going to do it while we're thinking of it, while I'm doing it too. I sometimes will do this. Is there's a straight leg rising test. You're checking for back pain. This is having to do with musculoskeletal. And so I'm going to have you bring one foot up, straight up, and straight down. Do you have any back pain? Can you do it the other leg? Good. And down. That's called straight leg rising. You're checking for lower back, lower sacral discomfort or pain with that. Now I got her in a great position. I might bring her up a little bit. I'm going to do an abdominal assessment. I'm going to bring up a little bit more. Working. Okay, very first step with an abdominal assessment is inspection. So you're going to inspect her abdominal cavity. Normally you could have it, what can I expose it?
Yeah.
Okay, fine, good. So you're looking for contours. You may even look down here like this to see if there's scaphoid, if there's distension, things like this. You're going to look at her abdominal cavity. You're also looking to see for scarring. They might have an umbilical ring. They may have tattoos. They might have stripes, stretch marks from having children, abdominal surgery of some sort, scarring, tattoos, any kind of abnormalities with this. The very most important part about this is the second step is always auscultation. It's always listening. You don't want to palpate or percuss next. You want to auscultate. So you're going to auscultate for two different things. You're going to use the diaphragm part of your stethoscope, and you're going to auscultate. I'm going to first auscultate for bowel sounds in all four quadrants. So you look where her umbilicus is. So this is her right upper quadrant, right lower quadrant, and you're listening for clicking, gurgling sounds. Hers are what they call nomoactive. They could be hypoactive or hyperactive depending on the frequency of what you're hearing. It should be clicks, gurgles. This is intestinal. The second thing that you're going to be auscultating for is cardiovascular. So you're going to be listening for the aorta, abdominal aorta. It's going to be looking probably halfway between the nipple line and where her umbilicus is, right in the midline. It might be a little bit deeper in this area. You're going to auscultate for any kind of bruise. And then I'm going to listen for the renal arteries. And then you'd also listen, at the femoral. There are iliac, is where the iliac spines are. You can listen for the iliac also. I don't believe that's on your exam, but that'd be another area you're listening for cardiovascular. If you're listening to, you can listen if you're listening for bruise. You may want to listen with the with cardiovascular. You want to listen with the bell part of it versus the diaphragm. So the diaphragm should be the bowel sounds. The aorta, the renal arteries, and the femoral listening for bruise should be the bell part of the stethoscope. If you do hear a rushing, like a murmur type rushing sound, you would not do any additional abdominal assessment. Next step is I'm going to be doing, is the next thing percussion? Percussion. We're going to do a percussion of a variety of different areas. We're going to percuss all four quadrants. I'm going to percuss the liver span. So I'm going to identify the liver as a dense organ, so it's going to sound a little bit, it's going to have a dull sound. Once that's hollow. Then you go up in this upper chest kind of area. So it's going to be right in this area here. That's very normal. It's between 4 and 6 centimeters. That's where you want it to be, 4 to 6 inches. It's going to be right in this area. You're checking to see if there's any kind of, if it's enlarged in any way. You can percuss the spleen also. You don't identify the range. You can identify where it is. So I've done the spleen, the liver, and all four quadrants that I'm percussing. Now palpation. Palpation, we palpate about everything in your abdomen. So you can palpate for the liver. Sometimes you will not be able to palpate this unless it's enlarged. You go under the cusp of where the costal margin of the ribs are. You're going to palpate. Might be a little uncomfortable. Might be palpating deep. You want to feel the margin of where the liver is. You can also palpate the spleen. Also, it's on the left side. It's under the costal margin of the ribs here. You may not be able to palpate that. Palpating the kidney. They call it capturing the kidney. You can go under the back side here. Sorry, I'm cold. Okay, just relax. Now I'm going to press quite deep. You may not be able to palpate the kidneys, and they kind of right in the fascia, kind of in a deep abdomen. I'm going to have you take a breath in. And you may be able to feel them move with that, but that's how you palpate for the kidneys. Now we're going to palpate. I'm going to wait with the abdominal cavity. You can palpate their bladder, which would be above the symphysis pubis. You palpate for inguinal and femoral lymph nodes and for hernias. So you'd be palpating in the lower inguinal area, that kind of thing for inguinal hernias or femoral hernias, and you'd be palpating for inguinal nodes. Now let's do the palpation. You do 3 different palpation techniques with abdomen is light, moderate, and deep. So the light. Do it in a circular motion. You're going to do all 4 quadrants. You're actually observing your patient to see if there's any tender, if she's complaining of any kind of pain. If they come in with abdominal pain, you want to start in the opposite direction of where that abdominal pain is. So you don't want to palpate right over where the abdomen, where it's hurting. That kind of thing. So that is light. Moderate is a little bit deeper. Still checking for pain, and you're also assessing to see if you feel any kind of abnormalities. I go in a circular motion so I can cover all areas. You don't want to skip anything. And then deep, sometimes you're using both hands. You can go quite deep. You can go 2 to 3 inches deep also, looking to see if there's any kind of having any pain or discomfort with this. All 4 quadrants. Now our specialty test 2. Let's do a variety. Rebound tenderness. You're checking usually for appendicitis. It's usually you'll be doing it in the right lower quadrant where the appendix would be located. So what you do is you press in and you retract quick. It's called rebound. If she complains of pain after, like as you're releasing, that would be called rebound tenderness. There's an ascites test. I'm going to have you put your hand right in the middle, kind of right like this. And I'm going to check for fluid wave and accumulation of fluid. So what you'll do is you can either tap or move, and you may feel that vibration on the other side. Depends. If they're very obese, it might be a little bit harder to assess that. But if they got fluid, maybe some liver involvement, you would actually feel that vibration on the other side. Okay. And then the iliopsoas and the arbitrator exam, also identifying appendicitis. They normally would do probably an ultrasound, maybe a CT scan, that kind of thing. But this would give you kind of quicker diagnosis of if they've got any kind of inflammation around the appendix. So Marina, I'm going to have you lift your hands up against my resistance, your leg up against my resistance. So try to raise this leg up. And I'm pushing down on this. Is pulling on that muscle here. If she complained of pain with that, then that would be indicative of appendicitis also. And then the arbitrator, you can bend their knee, bend their hip, bend their knee, and there's several ways that you can do it. You can bring the foot out like this. You can stretch sometimes like that, and sometimes it's like moving like that. There's stretching, so you might be moving like that. Also, you can actually have them, let me show you one other way. If you can turn just partially that way, without going over, yeah, you can bring this leg back, because that stretches that muscle too. Okay, great. Okay, now abdominal reflex. So this is also found in neuro, but while I've got her here and her abdomen exposed, I'm going to do a superficial reflex. Use the end of the reflex hammer. You go where her umbilicus is, and you go away from it, and you may see, just not really deep, you may see a surface, you may see them move towards their abdomen. Different directions, looking for kind of a movement this way. Males would have a chromatic reflex that would have you stroke the inner side of their thigh, and their scrotum would rise. And then the superficial reflex, the last one, is the plantar reflex, which is also under neural, but I've got her right here. So I'm going to, at the plantar surface of her toes, is I'm going to bring it up and around the outside and bring it around, and her foot should normally do plantar flex, not dorsal flex. It should be plantar flex. Sometimes I'll do it with my fingers here, that kind of thing, if you don't have a reflex hammer handy. I think that is all. Palpation, percussion, auscultation, inspection, and the additional exams. Inguinal, hernia, bladder, lymph nodes, femoral, and listen for the femoral bruise when I'm auscultating. Okay, I'm going to have, actually we'll try, well, no, let's follow your, okay, come in, you can sit up. And I'm going to lower this bed down. You can sit at the side of the bed. Well, I think we're going on to musculoskeletal. Center of attention. Okay, so actually I'm going to have you do this. We're going to generally actually inspect. I'm going to have you stand. This is a standing. So I'm going to, very first thing is inspecting her posture. I'm seeing how she's standing. I'm checking actually the symmetry of her limbs, the limb length. I'm seeing how she's standing, if it's erect, if there's any kind of abnormalities, the natural, I'm looking profile also to see if there's any kyphosis or lordosis, unusual curvature of her spine, and then I'm going to check for scoliosis. So I'm going to have you step out this way, and I'm going to have you bend forward. So I'm looking for scoliosis, so I'm going to look and see if there is a curvature of her spine. This way it's scoliosis, and I'm also going to palpate, I'm inspecting her spine, and I'm going to palpate her spine, see if she's got any kind of tenderness, pain, and nodules, anything that I feel along here. So I'm looking for the curvature of the spine, and you can stand back up. And I'm also looking to see if she's got palpating, see if she's got any nodules or pain or anything assessed with that. The next step is looking at her extremities. I'm going to look actually at her, let's do, well, they do range of motion, they do strength, and so and joints. So I do a combination of them. You're only going to be required to do one side, not the whole body. So let's do some let's look at range of motion with your joints and with your, and looking at, let's just do your extremities and your joints. So I'm going to have you raise your hand up and down. Okay, I'm going to have you repeat what I do. Okay, that'll be easier. So raise your hand out like this, and back, and forward, and back, and above your head, and bring your elbow down. You're going to internally rotate, external, any pain with this. Good. You can bring down like that. Good. Now, can you turn like this? So you're checking all motions of their joints and movements. Looks like freely. You could do the other side and check for symmetry. Now I'm going to actually, when I'm doing those, some of these motions, I'm going to palpate her joint also to see if I feel any crepitus with this at the same time. Okay, now with the extension and flexion with your elbow. And I'm looking to see freely movement, if she's able to move this. And I'm also checking for crepitus with the movement, seeing if she's got any with her elbow. Let's try the wrist. Okay, so I'm going to palpate while you're doing this. Bring your wrist forward, back. Can you bring it side to side? Good. Can you rotate it around? Good. Okay, and then you check their joints also here. You're inspecting rheumatoid arthritis, variety of different gout, variety of different disorders. And then let's check your mobility with your joints. So can you spread your fingers? Can you put them together? Can you curl your hand? Can you extend them? Good. Okay, great. And then what I'm going to do is I'm going to actually test the muscle strength now. So it's not only that I've just done one upper extremity, we'll do the lower extremity when I want to have you sit down. I'm going to have you test muscle strength. So I'm going to have you push against mine. I'm checking for symmetry, and I'm going to have you pull. Good. And then I'm going to have you squeeze my hand. Squeeze and touch. Good. So I'm checking for bilaterally for muscle strength too. And then I'm going to have you bring your hands up like this. I'm going to have you push against my hands out. Good. And push your hands in. Good. So you're checking different flexion and extension, variety of different things for muscle strength. And we'll do that with the lower extremities too. There's a couple specialty things I'm going to do with your upper extremities, the Neer and Hawkins test. The Neer, I'm going to have you go ahead and lift your, let's just do this side. We'll lift it straight ahead, up above your ear. Any pain or any difficulty with that, so if you had any difficulty with. And then the Hawkins test. So I'm going to actually have you bend your hand like this. There's different ones. You can do it like this and bring it down. It's really, I think it's like this, and it's like this. And you're looking for pain. And actually just keep your shoulders level. This is at 90 degrees here, 90 degrees here, there. 90 degrees there. So you want to keep this 90 degrees here and not have them move their shoulder around. That's the Hawkins. Okay, let's have you sit at the, let's have you lie down. We'll do the lower extremity. It's a little bit easier lying down. So we've done the upper extremities, the shoulder, elbows, wrist, fingers. We're going to do hip. So I'm going to, and we've already done the straight leg rising. So we'll do abduction and adduction. If you could take this leg and swing it over the top of this leg and then back out. Good. And if you could point your toes, yep, sideways and then in and out. So I internally rotate. Good. And I'm going to bring this up. And like this. Okay. And we're doing flexion and extension of the knees. And I'm also palpating at the same time to see the joints, see if there's any crepitus with that. And I'm going to go down and I'm going to check the ankles. Can you move your ankle all around? A little bit of crepitus with that. Good. And can you point your toes? And can you flex your foot back? We're checking ankle. Right? And can you, I can't talk, sprawl, okay, and then can you invert, and can you, yeah, good. So we're checking flexibility, range of motion, we're checking joint movement. Now I'm going to check the patella, that's under musculoskeletal too. We've already done the straight leg rising, but we're going to check for the movement of the patella, the allotment, so see if that moves. So we'll check where her kneecap is, and we'll do some movement motion. It should move up, but it shouldn't move freely. I mean, it should move out of place, and you shouldn't have an extra buildup of fluid around that allotment of that kneecap patella. I'm going to do the drawer and routines with that. So I believe that's musculoskeletal. Okay, I'm going to have you sit up beside the bed. Neuro. We're on to the neuro. We're doing the last little bit of this. So, proprioception, we're going to do a variety of tests with this. So, the first one is I'm going to have you do just what I do, rapid alternating hand motions. So, I'm going to have you put your hands on your lap and move them back and forth. Now do them fast. Good. Now I'm going to have you do the fast motions with your fingers. You're going to take one finger and touch your thumb to your finger and rotate back. Look at this. You're doing great. Okay. Now we're going to do the nose to finger. So I'm going to have you take your finger and touch my finger. and touch your nose. Good. Now I'm going to have you close your eyes and extend your hand sideways. I'm going to have you take each hand and try to touch your toe and touch your nose. There you go. Good for you. Okay, you can put your hands. Now, when she's let's have you stand. We're going to check gait. I'm going to have you walk this way. I'm checking for arm motion, movement, opposite arm, opposite leg. Good, and you can turn around, and you can come back. And can you okay, great. Can you do heel toe? Perfect. Okay. Now, when you're and then just stand here. I'm going to have you do your shin to your knee. Also, so you're going to stand on one foot if you can, and move your shin to your knee, and then back down. Good. That's also identifying proprioception. Now the Romberg, not Rosenbaum, not that. Romberg is this. Have your knees and actually your ankles, your feet together. Are your feet, is that as close to your feet you can get?
Yeah, I have my bone right here.
Okay. There you go. That's fine. Now you're going to have them close their eyes. So stand close to them so that they teeter. You can just close your eyes. And you're just checking for unsteadiness if they move around. Sometimes people will move them and see if they right themselves, but we don't ask for that for this exam. The second thing is I'm going to have you, I don't think we asked, but I always like to do this, pronator drift. Okay, I'm going to have you face your hands up and close your eyes. I'm going to let go of your hands, and you see if one drifts off. One might go off, that kind of thing. First are held pretty steady, no tremors, things like that. Okay, great. Okay, Maria, can you sit down? Okay, so we did the sensation. We're going to do vibratory sense in upper and lower extremities, and a variety of other different things. So you're going to tell me where you feel this vibrating. I'm going to have you close your eyes, and let's just do that. We'll do that. Yes, just tell me where you feel this, okay? And if you feel the vibration. And then with your lower extremities, I'm going to have you identify where, like right or left. And then you're going to identify also when you feel the stop, okay? Left what? Stop.
Right ankle, bone. Right side. Stop. Last one. Shin. Stop.
Okay. Yeah, good. So we already did the other with the, so we're going to do a stereogenesis or stereognosis or graphasia. So stereognosis, you're going to identify something in your hand and you're going to tell me what it is.
Battery.
Okay. And do one more thing to identify. Good. And then I'm going to write a number in your hand. This is graphasia. I'm going to write a number, and you're going to identify what number this is. Good.
7.
Good. Now reflexes. Let's do we did the two superficial reflexes already, the abdominal and the plantar reflex. Let's do the other reflexes. We have 3 of them that we checked. The brachial radial is the first one. So you can support their arm, do it midway through on their radius here, and you're going to watch for flexion of her wrist area. Do this through this. It's going to be right in this area. It's going to be somewhere in there. And then it's the patellar, so is your feet dangling freely. Okay, and you locate where the patella is, and you go right down below that. Let's see if I can do this. There we go. Just right in here. And then you have the Achilles, which is the lower behind the ankle. And sometimes you can support their foot. Sometimes you leave it dangling. And they should have a little bit of what they call plantar flexion with their foot. They're actually their foot, not just their toes. So you should know what the expected response should be. There you go. So those are the deep tendon reflexes. I did the conus already, and then nuchal rigidity earlier. Is that it? Mm-hmm. Okay. Is there something I forgot?